A pediatricians group, the American Academy of Pediatrics, has announced its first major shift on circumcision in more than a decade, deciding that boys flat out are better off circumcised than not, and that the benefits clearly outweigh the risks. Now, this is something that's gone back and forth over some time. This is the first revision since 1999. Now, in 1999, the Academy backed away slightly from circumcision. At the time, they concluded there wasn't clear evidence for or against circumcising. Then, the popularity of circumcision actually did decline, Lewis. Only about 56% of newborn males are circumcised since that time. I'm surprised at how low that number is.
Yeah, me too. See, but I thought this was old news. I mean, I've been hearing for years about the risks of not circumcising your child.
I get a lot of emails from people saying that they want me to talk about the brutality of not the insect world, like the Krakatoa Metal Band album, but the brutality of circumcision.
Yeah, so brutal.
Now, here's the new information, or the confirmed information. Number one, circumcision helps baby boys pretty much immediately, reduces risk of urinary tract infections during the first year of life by up to 90%, which is significant.
Oh, by the way, urinary tract infections can be fatal.
In children under 1.
In anyone, if it goes up to your kidneys and eventually shuts them down.
Or in certain cases. Also, circumcised males less likely to get infected with a long list of sexually transmitted diseases over the course of their life, drops the risk of heterosexual HIV acquisition by about 60%, drops the rate of HPV and all sorts of other infectious diseases, and also reduces the chance significantly that the man will spread HPV to the wife or girlfriend, which of course can lead to cervical cancer in women. So very clear here. Now, what do the critics say? Critics, of course, are unconvinced. They say male baby circumcision is the same as female genital mutilation. Now,
I've never heard anything that stupid in my life.
A lot of people make that comparison, Lewis.
Well, they're all idiots.
Oh, wow. Lewis taking a big stand on this. So the critics argue that the scientific data is questionable, that studies on HIV reduction have only been done in Africa, where AIDS is much more common amongst heterosexuals. Critics are saying that too many botched circumcisions leave boys damaged for life, so on and so forth. The bottom line from the medical group is that the right call is circumcision. Very controversial. Natan, what do you think about this?
Yeah, I don't know what to think about this. I recognize that some people view it as genital mutilation, and in the literal sense, it's hard to argue otherwise. At the same time, given all the positive health benefits and the long tradition of doing this, and the fact that it really doesn't hurt the baby in any significant way, I'd have to be in favor of it.
Well, however, some people say that it does traumatize the baby, that pain at such an early age traumatizes the baby in ways that simply affect the baby's personality throughout their entire life.
By that standard, all Jews and Muslims have that issue, which some people might agree with, especially
maybe
some of
this
the
is
religious
responsible for Jewish neuroticism. I don't know. I don't know what to tell you.
Yeah.
What about Muslim neuroticism?
Well, that
does not exist as far as I know.
I'm not as familiar with it.
Right.
Okay, so send me your thoughts. I know this will be a controversial topic.